To understand the effect that stress has on us and what we can do about it, let's use a model called the Stress Appraisal Coping Model. The Stress Appraisal Coping Model suggests that our response to a stressor is because of our appraisal, that is, how we see the stressor. When we think, this is too much, I can't deal with it, we will react differently than if we think one thing at a time, or I can do this slowly, or I can ask for help. Now, I'm not advocating positive thinking, and I'll have another presentation about this. Rather, what I want to highlight is that our thoughts affect how we feel. Now, two other factors influence our stress response. Resources, or the absence of these, affect how we respond. Resources include friends, social supports, money, and information. Another factor that affects our coping is our coping style. Broadly speaking, there are three coping styles. The first that we can think of is avoidance. Many behaviors can be classed as avoidance, such as using alcohol or overeating. Unsurprisingly, avoidance worsens our responses. Problem-based coping is where we're trying to change some aspect of the environment and we ask ourselves, what can I do to solve this problem? Research indicates that problem-focused coping improves outcomes. In contrast to these other two forms, emotion-focused coping is where we're trying to change something internal. Now, overthinking is an example of this type of coping, and overthinking is an emotion-focused strategy that actually worsens and prolongs depression, anxiety, and stress. Even when we can't change the stressor itself, what we can change is our appraisal, the resources we have, our coping style, and ultimately our response to the stressor. Doing these things can actually influence and decrease the stressor or stressors themselves.